Hey, future nurses, ready to crush the NCLEX, HESI, and ATITs exams? Memetrics is here to make studying fun and effective. Whether you're into flashcards, practice tests, or video tutorials, they've got something for you. Let's take the NCLEX, for example. I know by the end of nursing school, you are burnt out and would rather do just about anything if it meant you never had to study again. But hear me out. Memetrics makes it fun and provides so many tools to help you study the way you want. Picture this, 110 NCLEX review videos to break down tricky topics, over 1,600 practice questions with rationales, and 1,000 flashcards to quiz yourself anytime, anywhere. Plus, they have 12 practice NCLEX exams that you can tackle before the big day. And the best part, it's affordable, flexible, and fits into your schedule. Head to the show notes, use code Caroline20 and get 20% off. Get started with Memetrics today and go crush your career goals.
Hey, welcome to Life After Nursing School. I'm your host, Caroline Dana, aka Nurse Coach Caroline, and I'm here to help you, the new nurse, thrive in your career. As a former nurse recruiter, nurse manager, and now your personal new nurse career coach, I'm obsessed with making sure you don't just survive your first couple of years at the bedside. I want you to absolutely rock them. From the challenges to the triumphs, I'll be right here with you, giving you the real-world advice and support that you need to shine. Whether you're in nursing school getting ready for life after, or you're already out there in nurse life feeling overwhelmed or even questioning your confidence, I've got your back. I'll be sharing tips, tricks, resources, and strategies that are just for you. We'll dive into everything from landing that dream nursing job to slaying imposter syndrome, and most importantly, how to keep that spark alive and stay the vibrant and amazing nurse that you are. So if you're ready to tackle the things nursing school did not cover, like how to build a career, trust yourself, and keep your passion strong, then get comfortable because we are about to dive in and make nurse life the best life.
So happy to chat with you again. Today's episode topic is largely focused around clinical. Whether you are anticipating your first clinical rotation as a nursing student, or maybe you are a few rotations in, clinical is a place we can learn a lot, but it really is one of those situations where what you put into it is what you will get out of it. I remember some of my peers in nursing school hiding in the utility closet, scared to mingle with patients and also terrified of our instructor. Guess what? Hiding in a utility closet is not going to help you become a good nurse or even learn how to be a nurse at all. I want to acknowledge that it is normal to feel nervous, inadequate, out of place, scared, and anxious while at clinical. It's tough to be new at anything, and I want to remind you that we have all been there. Every nurse has been in your shoes. When learning something new or being new in general, I have always found it's best to just jump in headfirst. I've noticed an influx of messages on social media about being nervous for an upcoming clinical rotation and how to best prepare for clinical. So this episode is for you. As some of you know, I am a clinical instructor myself. I typically start each semester teaching specific topics and skills in the lab setting to first-year nursing students. After a few weeks into the semester, I take a group of 7 to 8 nursing students to a local hospital and onto a med-surg floor. And I want to let you in on what it is we as instructors are looking for in our students. First, a main topic I want to talk about is professionalism. This is basic, but let me tell you, most students struggle with this piece of clinical. We want to see that you are treating clinical as if it were a real job. Sort of like training wheels or a trial run before the real deal. I understand most clinical rotations in nursing school are pass or fail. So yes, you can sort of go through the motions and pass. However, we want to see you treat this experience as if it were based on a challenging scoring system, just like your nursing classes. Nurses take pride in their practice and work very hard to become a well-respected member of the profession. And in order to be respected, we need to be professional. So let's jump into professionalism and break it down for you. First and foremost, come to clinical on time. Plan for extra commute time and additional time to walk from your designated parking area all the way to the hospital. You may even have to take a shuttle, and many times shuttles run on a set schedule, and it may be another 15 to 20 minutes before the next one shows up. Also, plan to get to your clinical unit about 5 to 10 minutes early. This allows you to put your bag down, get on your badge, gather your other work items like your stethoscope, watch, paperwork needed for the shift, etc. Then you have a few minutes to get to your designated meeting space for pre-conference. And in order to figure out what time you need to leave your house or wherever it is you're coming from to make it to your unit on time, let's consider or practice reverse planning. We can use my clinical group for an example. My group meets at 6:30 in a family waiting area at the end of our unit. My students should give themselves about 5 to 10 minutes once they get to the unit to swing by the break room, drop their bags and coats, gather their items needed for the work shift, like their stethoscope, badge, watch, pen, paperwork, etc., so that when pre-conference is over, they can go straight to the floor and hit the ground running. So if we are working backwards, and again, we know pre-conference starts at 6:30 in the morning, this brings us to arriving on the unit at 6:20. Now, it is about a 15-minute walk from our parking lot up a pretty big hill to the hospital lobby, up to the unit. So if you back up 15 minutes from the 6:20 a.m. unit arrival time, we have determined that our parking lot arrival time to be about 6:05, meaning, just so I don't confuse you here, that we're parking our car at 6:05, taking 15 minutes to walk from our car up to the unit, which brings us there to the unit by 6:20. Then we have about 10 minutes to put our bag down, get our supplies, and meet in the pre-conference in the family room. Now let's factor in our commute. We will go with a typical 30-minute commute just for this example. And I would recommend that you add about 10 minutes to your commute time just in case you hit traffic or you get lost, especially for those first few trips to clinical where you're not exactly sure where you're parking or where you're going. We have determined that we are supposed to be parking at our designated parking lot at 6:05. So if we factor in a 30-minute commute with a 10-minute buffer, we are heading out the door in the morning at around 5:25 in the morning. It is crucial that you arrive to clinical on time. Once you are working as a nurse, punctuality is closely monitored by management, and your peers rely on you to arrive on time and be reliable. Most instructors expect punctuality to start now. In addition to punctuality, it's important and professional to be readily prepared for the clinical shift. I recommend having a designated bag just for clinical and filling it with the needed supplies to get through your shift. Here you will have your stethoscope, pen, badge, watch, or any other personal items that you might need to get through clinical, as well as paperwork required for your program. As for clinical paperwork, every nursing program is different, but typically students are required to complete specific worksheets while at clinical to help develop your critical thinking skills. So if you are expected to pass in a head-to-toe assessment every shift, print out one copy of this document for each of the number of clinical shifts that you have for the upcoming semester and keep them all in your clinical bag ready to go. For example, if you have 16 shifts this semester and are required to complete a head-to-toe assessment worksheet each shift, print out 16 and maybe an extra one or two copies and have them in your designated bag at clinical. This will allow you to get up at the butt crack of dawn because, yes, clinical often starts so incredibly early and leave for your clinical site prepared and in a timely fashion. Okay, so we've covered professionalism when it comes to punctuality and being prepared. Now let's talk about professionalism in the sense of your actions. It is important that you act in a professional manner at all times at clinical. Collaborate with staff on your unit as well as your peers, and please be mindful of your socializing as well as your phone use. Whether you believe it or not, instructors know when you are chit-chatting in the break room or hiding in the utility closet with your friends. Will this result in a failure? Probably not. However, instructors do bring this information back to full-time faculty, and they likely won't be as open to potentially writing you a letter of recommendation for future job opportunities or as willing to extend their neck for you in other ways. As for phone use, I understand we use our phones for everything. Maybe you are using your phone to log into a pharmacology app or something nursing related or educational. But unfortunately, it's the perception that we are trying to protect here. If staff see you sitting down on your phone or leaning against the wall looking at your phone, they will 100% assume you are scrolling social media or texting your personal contacts. I know this is harsh and can be frustrating, but staff do complain when students are perceived as lazy, unengaged, or unprofessional. Instead, learn which resources live on the hospital computers that are there for you to use. Most hospitals have Elsevier and LexiComp built right into their electronic medical records or intranet, so you can look up pharmacology related questions or nursing procedures or hospital protocols. I promise you, staff and your instructor as well would rather find you researching nursing related topics on a computer on the unit rather than doing so on your personal phone. On top of limiting socializing and phone use, your clinical instructor wants to see you and their other students engaged throughout the clinical shift. We want to see our students reviewing their patient's chart, asking appropriate questions about their patient's condition or plan of care. We want to see our students in their patient's room, mingling with staff appropriately, collaborating with their peers, and jumping into every opportunity they can to learn. Okay, we know how to engage with our patients, but what about the staff? Nursing school helps us to learn how to care for our patients, how to communicate with them therapeutically, and how to best advocate for them. But nursing school does not teach us how to engage with staff. So let's chat about how to do that. I also understand everyone's clinical experience may differ. Some rotations, you may follow a nurse the entire shift. Other times, you are assigned a patient or two and do most tasks with the instructor. Take the next few tips and apply the ones that are most applicable to you, and feel free to tweak the others to fit your clinical environment. Okay, once you receive your patient assignment from your instructor, I recommend connecting with the primary nurse as soon as you can. Depending on your clinical hours and the workflow on your unit, maybe you have the opportunity to hear the nurse from the previous shift give a report to the oncoming nurse. This will be a great way to get a detailed report and also to introduce yourself to the oncoming nurse. If you aren't able to make report, here's an example of a helpful introduction that you can use as a guideline. Hi there, my name is Caroline. I am a nursing student here for day shift. I believe you are the primary nurse for the patient that I have been assigned to with initials JR in room 26. If you have a moment, could you give me a quick report? I will be passing medications today, obtaining vitals, and doing blood sugar checks, as well as providing the patient with ADL assistance. I am also happy to help in any other way. And if you find yourself preparing for a nursing task or intervention like wound care, catheterization, IV placement, or anything along those lines, I'd love to watch. And we will be on the unit until 2 o'clock today. I like this example because it explains what tasks you will be completing so that the primary nurse understands what you can do and the tasks that he or she will still be responsible for doing. It also is helpful to explain what time you will be leaving the floor for post-conference. After connecting with the primary nurse, it's also helpful to chat with the tech assigned to your patient. Introduce yourself, explain the tasks that you will be doing. For example, vitals, blood sugars, bed bath, hygiene related tasks, just so that they don't complete them. Some techs are so efficient and have a pretty structured workflow that if you are not clear in the tasks that you are owning, they may proactively complete them for you. And when I hear from my students that the techs already did something that they should have done, I automatically know as an instructor that my students did not use effective communication when they connected with the tech at the start of their shift. In addition to a collaborative introduction, continue to touch base with your primary nurse throughout the shift. You should be relaying helpful information and findings like vital signs, blood sugar results, INOs, and any other patient concerns. Let your primary nurse and tech know when you leave the unit for a break and check back in when you return. This helps to establish a trusting and collaborative rapport. The more you practice introducing yourself to the staff and collaborating with them on upcoming tasks, the more they will engage with you over the weeks to come and see you as a member of the healthcare team. I sort of have this theory that I've developed over time as I've changed nursing jobs and having been a clinical instructor for a few semesters now. And the theory is that most staff, no matter the unit, take a little bit of time to warm up to new people. And when I say new people, this can be new employees or new students. Nurses tend to be very protective of their unit, they're protective of their practice, and even their patients. I find that there is a period of time where the staff are sizing up the students and or new employees. And over time, if you continue to consistently show up with a positive attitude, ready to jump into action and willing to help in any way, the staff warm up to new team members, including nursing students. It's like there's a period of staff skepticism. And once you prove your credibility and your dedication, the skepticism transforms to acceptance and collaboration. Now, on the flip side, if during that time period where the staff are unsure about you and still sizing you up, if during that time you are hiding in the utility closet, socializing with your peers, sitting on your phone, not engaged with staff or the practice or the unit, they will not warm up to you, okay? They will not seek you out for learning opportunities, and they may even report you to the instructor or to their manager, who will relay the information to the instructor or directly to the school. So, to recap for a moment here, we have discussed that your clinical instructor expects professionalism from their nursing students, and that looks like being punctual, being prepared, and being engaged, okay? That is not terribly challenging. Okay, I can already hear you saying, wait, Caroline, can we talk about what we're supposed to be doing at clinical when it seems like there's nothing to do? And before all of my fellow nurses have a stroke listening to this or come for me as I claim there are times when it feels as though there's nothing to do at clinical, hear me out. When students are given one patient, sometimes we do find ourselves with some downtime, especially on the unit that I'm on. It's a smaller unit, and when I have 7 to 8 students and they all have a patient, sometimes patients are actually well cared for, and we find ourselves in a bit of a slow pace on the unit. And just a friendly reminder or PSA for nursing students, this is not common in the real world. And when you have a full assignment, there is never truly downtime, okay? Because there's always something that you can be doing. But for learning purposes, let's chat about things that you can do when you don't know what to do or feel like there is nothing to do while at clinical. There are times when you may find that your patient is content, your assessment's done, staff don't need any help from the nursing student at the moment, and you feel as though you're twiddling your thumbs, but yet you don't want to appear as though you're not engaged. So, here are 5 ideas or things that you can potentially do. First, take some time to dive deep into your patient's chart. Look up their medical history, look up notes from other multidisciplinary healthcare members. Maybe there's a note from PT or from social work. Review imaging results. Pull up the image if possible and try to get an idea of what you're looking at. Review your patient's vital signs since the start of their hospital stay. Are they trending in a certain direction? Are they stable? Are they consistent? Now do the same for patient's lab work. Review previous nursing documentation of your patient, okay? Look at previous nurses, they're charting for their head to toe assessment. Does it match your findings? If not, why? Maybe you see the previous nurse document wheezing in the left lower lobe of the lung. Maybe you need to make a note to go back to your patient's room and re-listen to that side of the lung. Maybe the wheezing has resolved, or maybe you didn't hear it the first time, but now that you know what to look for, you can really listen. There's so much information that we can gather from our patient's chart, and learning how to navigate an electronic medical record is a skill that takes time and hands-on practice. Okay, idea number 2 to do when you feel like there's nothing to do while at clinical. Get to know your equipment and supplies. Go to the supply closet and look through the many shelves of supplies. I do not recommend opening packages, but getting to know where items are located is extremely helpful. And also, most items are in clear packaging, and you can get a look at them without having to open up the package, and then you can really familiarize with those items. Supply closets typically have all hygiene-related items for patients like soap, lotion, toothpaste, toothbrushes, hairbrushes, emesis basins, bedpans, wipes, and pericare related items, external catheters like PureWicks, Chucks pads, Triad paste, barrier cream, ice packs, water jugs, and so much more. You can also likely find items for nursing procedures in the supply closet, like urinary catheter kits, NG tubes, wound care items, suction canisters and yank hours, oxygen tubing and masks, specimen cups, IV placement kits, and blood draw supplies, and more. In addition to your supply closet, most units have a designated area for larger equipment like sit-to-stand machines, Hoyer lifts, bladder scanners, EKG machines, and Dopplers. Spend some time in these areas looking, handling, and familiarizing yourself with the supplies and the equipment. Okay, idea number three for something to do when you feel like there's nothing to do while at clinical. Answer the call bells, even the patients that are not yours. In pre conference with my group, we review which rooms the patients cannot go in due to hospital policy or our program protocol. For example, we have to stay out of rooms where patients have been deemed combative or aggressive. We also are not allowed in airborne precaution rooms as my students have not been fit tested. So, my students should know by the beginning of the shift which rooms are sort of off limits. And if patients ring their call bell and they're not known to be aggressive and they're not on airborne precautions, students can and should be answering the call bell. Many times, the patient just wants a simple request like a warm blanket or lights to be turned off or to hand them something that's out of reach. If the request is something more robust, students find the appropriate staff member, usually the nurse, and they relay that information to them. Staff also appreciate when students are actively answering call bells and taking care of minor needs. It helps with their workload immensely. Okay, idea number four for something to do when you feel like there's nothing to do while at clinical, and that is to round on patients. Rounding is the act of proactively checking on patients, and many hospitals encourage and expect their staff to perform hourly rounds. Hourly rounding, also known as purposefully rounding, is a patient care strategy that involves nursing staff checking on patients at least once every hour to ensure their basic needs are met and also to enhance patient satisfaction. It focuses on proactively addressing patients' physical, emotional, and safety needs before they have to call for assistance. Things you can check for during rounding as a nursing student are things related to patient comfort. Is the patient comfortable? Do they need another blanket or pillow? Are the lights too bright? The nursing student can also ensure safety during rounding, okay? This may look like ensuring the call bell is within reach or personal items are easily accessible to the patient. Maybe they're checking to make sure that the patient's bed is in the lowest position. Doing these things prevent the patient from falling while they're trying to reach for an object or trying to get out of bed. Next, while rounding, you can check in on hygiene and toileting. Ask if the patient needs assistance with going to the bathroom or help with any personal hygiene related tasks. And information is obviously a big one during rounding. You can answer patient questions or concerns or relay that information back to the primary nurse. I want to add here that I will add to the show notes a purposefully rounding PDF tool that you can print out and bring with you to clinical and use if you want to try rounding on your patients. Okay. If you are unsure what to say when you round on your patients, especially those that are not in your assignment, provide a brief introduction about you and the purpose for your visit. Let me give you an example. Hi there, my name is Caroline. I'm a nursing student and I'm rounding on the patients on the unit. So I just wanted to pop in here and see if there's anything that I can do for you. As you can see, the introduction can be brief and really you are just seeing how you can help the patient in that moment in time. Hourly rounding not only improves patient satisfaction by reducing anxiety and fostering trust, but also helps prevent falls, pressure ulcers, and other complications, leading to better overall patient outcomes. Additionally, it promotes better communication between the healthcare team and patients. Okay, last idea for something to do when it feels like there's nothing to do while at clinical is to round on staff and your peers. Check in with your patient's assigned tech and nurse and ask if there's anything you can do for them. Maybe they need a second set of hands to reposition a patient, or maybe they want you to empty a drain or measure a specific type of output. This shows you're engaged, collaborative, and eager to learn. After you round on staff, consider rounding on your peers. Check in with other fellow nursing students and see if they need any help with something, if they have any questions, or if they need a set of hands for a task that they have on their to-do list. Okay, so far we have discussed that your clinical instructor is looking for professionalism. He or she wants to see their students arrive to clinical on time, prepared to hit the ground running, and appear to be professional in their care delivery on the unit. In addition to this, the clinical instructor also wants to see that you are developing your critical thinking skills. In the nursing profession, critical thinking skills are essential for making sound evidence based decisions and delivering high quality patient care. These skills help nurses assess complex situations, solve problems, and ensure patient safety. To help develop critical thinking skills, nursing students can ask themselves a variety of questions that promote reflection, analysis, and decision making. Clinical instructors are able to determine the progression of a student's critical thinking skills by the kinds of questions and thought processes verbalized by the nursing student. Understanding the reason behind each order in the patient's chart, understanding the cause and reason for the patient's clinical assessment findings, and being able to anticipate nursing interventions is the foundation for a well-developed critical thinking skill set. And this is something that your instructor wants to see you developing. So here are some questions that you can ask yourself to help develop your critical thinking skills while at clinical. All right, we're going to begin with questions around understanding the situation. Okay, if you have a pen and paper, you might want to jot these down. Okay, ask yourself the following. What is the patient's primary concern or diagnosis? What are the key signs and symptoms the patient is presenting with? How do these symptoms correlate with the patient's history? What additional information or assessments do I need to gather to fully understand the patient's condition? Next, let's pivot to analyzing data and patient findings. So let's ask ourselves these questions in a way to help us critically think. What does the latest assessment tell me about the patient's condition? What labs, tests, diagnostic results should I review, and how do they influence the plan of care for this patient? Okay, now let's take a moment to explore options and interventions for our patient. What are the possible interventions for this patient's condition? What are the benefits and risks for each option? Is there evidence to support the intervention that I am considering? What are the potential outcomes of my chosen intervention? How can I anticipate complications or adverse effects from the treatment or intervention I'm referring to? What would happen if I don't intervene? Have all other less invasive options been attempted before moving forward with this said intervention? Critical thinking skills take years of experience to truly develop. However, this skill set starts to formulate in nursing school. The best time to start making connections between what you learn in the classroom and what you encounter in real life is at clinical. So ask yourself these previously mentioned questions, and if you are unsure about how to answer one of them or a few of them, consider asking your instructor or primary nurse. All right, I think we've covered a lot in this episode. As a recap, your instructor does not expect you to know everything or to be able to do everything independently, but they do expect you to act as an engaged professional working to develop your critical thinking skills. Remember, there is always something you can be doing at clinical, and if you continue to consistently engage with staff with an eagerness to learn, staff will collaborate with you more, and you will likely get much more out of the clinical experience. And who knows, it could even lead to a future job opportunity. I hope this episode provided you with insights on what it is that your nursing instructor truly expects of you, and I hope it helps you feel as though you can jump into clinical with a little less anxiety. See you next time, and as always, I have one hand for me and the other for you. Signing off.
Well, that's it for today's episode of Life After Nursing School. I hope you feel more confident and ready to tackle the challenges that come with starting your nursing career. Remember, the first year or two might not be easy, but with the right mindset, you can overcome anything. If you found value in today's episode, I'd love for you to hit that subscribe button so you never miss a future episode. Also, please consider leaving a review on your favorite podcast platform. It helps so much in reaching other new nurses like you. Thanks for listening, and remember, you've got this. Take care and see you next time.